Hello, my name is Danielle, and this is Megan and Madison. And today we're going to be talking about our community-based OT program, specifically about chronic conditions in the Cleveland Clinic.
So the Cleveland Clinic functional medicine vision is to offer a healthier, less medicated lifestyle for those with chronic conditions. The mission is our team has helped countless people lead healthier lives by reducing the burden of living with chronic disease. Our functional medicine program focuses on lifestyle influences, genetics, and the environment to determine what's causing your disease or chronic conditions. And the purpose, sorry. The purpose of our functional medicine team uses a holistic approach to treat chronic disease with a focus on nutrition, leading a healthier life from the inside out.
So a few different populations that are affected by chronic conditions. We have, just to point out a few, Alzheimer's, asthma, cancer prevention. We have cardiovascular disease, diabetes, which is a big one, and a lot of different things. So environmental and food allergies, thyroid disorders, and then those are just some to name a few, but you can take a look at this slide, and obviously there's quite a few impacting different populations, which is why it's so important.
So all of the occupations can be affected by chronic conditions, but specifically we're going to be looking at IADLs, specifically the home management, and we're going to be focusing on rest and sleep, and then we're also going to be diving into social participation.
So this slide just kind of goes over who works with chronic conditions and then what is specifically occupational therapy's role. So the role of OT in a chronic conditions program. So they work with patients dealing with chronic conditions in the functional medicine at the Cleveland Clinic here. And the role of the therapist is to use a holistic approach to help a client engage in meaningful occupations. So as Danielle said, she highlighted a couple of the occupations that the OT is going to focus on. Specifically in this program with chronic conditions, we wanted to narrow in on home management, social participation, and rest and sleep in order to help the client live a fulfilling lifestyle. And other professions that are prevalent in this type of program. So you have your functional medicine providers, which include physician's assistants, MDs, DOs, and certified nurse practitioners, registered dietitians, because nutrition is a huge part of this program, functional medicine health coaches, and behavioral health specialists, which also includes psychologists.
So this is the EHP slide. We chose to use EHP as our model for this. Sorry. And EHP has an emphasis on prevention and health promotion, which is important for someone with a chronic condition. So we want to understand what tasks are being affected and how we can work with all the different contextual pieces, which we have listed here, such as products and technologies, supports and relationships, services, habits and behavioral patterns, psychological assets, lifestyle, and even fitness, in order to make them more accomplishable. So increasing and maintaining that performance range of the individual is pretty much one of our biggest goals when dealing with a chronic condition. The context that a person is in within their home influences what they do. So using this model, OTs can guide our clients into thinking about their context and how they can manage their condition and improve their engagement. So overall, this model helps us guide our clients in areas where they want to see improvement and have those different aha moments, as we call it.
So within our program, we mentioned it before, but we are going to be focusing on 3 areas of occupation. So home management, rest and sleep, and social participation. And within these occupations, we're going to be analyzing different contextual factors such as products and technology, supports and relationships, services, habits and behavioral patterns, psychological assets, lifestyle, and fitness. So to start the program, we want to do a pre-assessment to kind of determine which specific occupation a client wants to focus on to really individualize the experience. So we're going to do the COPM, we're going to do a fatigue impact scale, and we're also going to conduct a sleep profile. And then you'll see listed under each occupation, we just have some brief topics about what will be done within the program for each occupation.
So going off of that, we kind of wanted to outline what a session could possibly look like. Based off of the pre-assessment, those are going to be able to highlight different areas that the clients want to focus on within the group. And from there, we can create the session outlines and have, different areas highlighted for different sessions. So the pre-assessment is completed to determine which area that wants to be worked on. And then step 2 is understanding pros and cons of challenging occupations. So the role of OT right here, we're not going to necessarily tell them the pros and cons. We want them to work with and kind of figure out the pros and cons on their own. So we'll facilitate the clients developing their pros and cons of what they want to work on. And then the client will lead the direction of the discussion, and we'll just be there to help if needed. Step 3, guided thinking education. So we will assist the client in recognizing how the behavior of the specific occupation they're engaging in may actually be affecting how they perform their occupation. So the example we have is client recognizes being on their phone at night is causing them to feel tired during their day. So the way that guided thinking works is like, we're not gonna, outright say like, hey, being on your phone at night is what's making you feel tired. You guide them in a way to help them realize that on their own. And then step 4 is implementation of different positive habits. And then, like, for example, the next session reporting back, they're gonna just let us know, like, if the implementation worked or not, and then we'll go from there.
So we did look up a few different professional developments that can just be helpful for us as practitioners to do in order to help our clients in this type of a program. A few was the therapeutic pain specialist certification, which can be done, obviously you do pay for it, but that'll be helpful in dealing with people who are having pain issues with their chronic management. We also have A-Train Education. They have a program, it's pain and its management course. Obviously, we can do any CEUs as possible, like as occupational therapist. The National Association of Chronic Disease Directors offers virtual courses for chronic pain management. And then we have the Chronic Care Professional Certification, or CCP, which is kind of like becoming a health coach for people who have chronic conditions.
And that concludes our presentation. We hope you learned something new today.